Now I call upon Dr. Radharamanan, our own homegrown ex-president from Chalakudi, iVision, to tell us about carbonic inhibitors.
Good evening. I think I am so surprised to have this many people in the auditorium, even though it's the last presentation. Carbonic anhydrase inhibitors is in our use for so many years. Actually, this is considered as a diuretic class of medication in the general thing. The FDA has approved it is used in elevated intraocular pressure, pseudotumor cerebrae, edema due to congestive cardiac failure, centrocephalic epilepsies, altitude sickness, prophylaxis, etc. I think those who are not having the Glaucoma Society of India guidelines, it is better to have everyone a copy of it. I think this is a very good one for your clinical reference. Coming to the classification, systemic, it is available. I am not going to the all trunks, acetazolamide, methazolamide, and topical is brinzolamide and dorzolamide. I don't have any financial interest in some of the photos I are showing it. The mechanism of action is the inhibition of the aqueous humor secretion by inhibiting carbonic anhydrase isoenzyme 2, which is found in the non-pigmented ciliary epithelial cells. This reduces the formation of bicarbonate ions, which reduces the fluid transport and then reduces the IOP. Actually, the inhibition of 99.9% of activity of isoenzyme 2 is required to achieve an adequate IOP reduction. Dorzolamide and brinzolamide have a special affinity for carbonic anhydrase 2. So, dosage and efficiency, a little bit about systemic also. Systemic acetazolamide 250 milligram 3 times, sometime even 4 times, but the systemic complications are more. Methazolamide 50 milligrams 3 times a day. Acetazolamide decreases the aqueous humor production by 30%. So, in turn, it produces an IOP reduction of 40%. Oral dose, maximum effect in 2 hours and lasts for about 6 to 8 hours. That is why 3 times we will be doing it, and washout time is about 3 days in systemic topic. Medication, again 2 to 3 times a day for brinzolamide 1% and 3 times for dorzolamide if it is mainly used as an monotherapy. If combination, most of the time it is used for 2 times. Decrease in aqueous humor production is 13% in daytime and 9% in night time. It is to some extent it is similar to the timolol thing, because night efficiency reduces to some extent. Peak IOP reduction in 2 hours varies between 16.3 to 22.9%. So this is what is the reduction we can expect in topical one. But it is less compared to the systemic, because topical act only carbonic CA2, but the systemic non-selectively it acts on 2 and 4. So there is an additional effect. So most of the cases we will see in the prescription we will see both systemic as well as topical in many of the prescriptions. So sometime it is accidental, because sometime you must have started on topical, then must have continued with again added on systemic. So there is no added effect on that thing. Contraindication comes on the sulfa allergy, renal impairment, depressed sodium. May not be that important in topical application, but you have to keep it in your mind. Hepatic impairment, low endothelial cell count due to increased risk of corneal edema. This is most commonly, because most of the prescriptions we can see that the corneal edema we will see dorzolamide prescriptions. But you have to be cautious, because it blocks the CA2 isoenzyme in the corneal endothelium. Pregnancy and lactation relative contraindication. In the first trimester, risk of sacrococcygeal teratoma and transient renal tubular acidosis in neonates. Adverse effects, mainly you have to think about hypersensitivity. Carbonic anhydrase inhibitors induce blood dyscrasias are very rare, but if it comes, it is a very, very complicated one. but you have to keep it in your mind. Fatigue, paresthesia, GI side effects, taste perversions. Most of the time you have to take the clear history. Sometimes the patient will be telling you, but you won't be giving that importance about the taste problems. The bitter taste feeling, decreased appetite, renal stone formation, malaise and acidosis. Ocular side effects like periorbital contact dermatitis and allergic conjunctivitis. Ocular tolerance of brinzolamide is better because it is pH and osmolarity is more of physiological range than the dorzolamide. But now we are into the more into the preservative free area, because when you are asking for a longer duration, better to have preservative free formulations or a BAK free formulation, to be more precise. It will be a little more costly, but now the price is coming down. It is not that problematic on that things. To conclude it, carbonic anhydrase inhibitors are used mainly as an add-on therapy in combination with the timolol and prostaglandin analogs. Use as a monotherapy is indicated in so many conditions when other medicines are contraindicated. Take care of adverse effects in systemic as well as in topical use. Thank you.
Thank you, sir. Thank you for a lucid explanation on carbonic anhydrase inhibitors. Just to highlight a point that all adverse effects can be used as a measure of compliance. So for example, if a patient is on carbonic anhydrase inhibitor and keeps coming and telling you that he's got metallic taste, so you can take it as a thing that he's adherent to your treatment. So similarly for pilocarpine, if his pupils are myosed, that means he's using it. Corneal anesthesia for timolol. And if you find one follicle in a patient on brimonidine, that means he still continues to use the medication. So you can